Hi everyone, welcome to Acupuncture 123 Live. I'm Szenan-Balance from Self-Balance, the acupuncturist. Self-Balance is in New Zealand, Hamilton, Dinsdale. Now, today's topic, we're going to talk about eye problem. The eye problem can be many, but the most common thing is dry eyes. A lot of people have dry eyes, and a lot of people have a painful in the eyes because in front of the computer a lot. Using cell phone a lot, all the time on the screen. So dry eyes and make your eye. A lot of patients with gritty eyes, like the sand in your eyes is painful, right? And how can we deal with that? As an acupuncturist, that's how I do needle for my patient. Okay. Now today I'm going to show you there are a lot of different strategy. Right. I normally use global balance to treat it. But when I do global balance, I love to do scalp acupuncture as well. And the scalp acupuncture, I choose to use true scalp acupuncture. As we know, true scalp acupuncture, we needle over here. Then as well as Tan scalp acupuncture and Fang scalp acupuncture. And they are the same area over here that represent the face and represent the eyes. Okay. Now, apart from here, what way can we do needles? We're going to talk about all this, and as well as we're going to combine balance method acupuncture, local balance to show you way to needle for the eyes. It can for a lot of different eye disease, not just for pain and not just for gritty eyes, not just for dry eyes. All right. Then if you first time watching this video on YouTube, please subscribe it, and there's a bell beside that. Just ring the bell as well. If you're on Facebook, please, I do live video every day, and I share on this page, and I do treat myself every other day in English platform to show everyone how to do the acupuncture. So you may learn a lot from my video. All right. Or if you have any question, you have any case that you think you're not sure about how to treat, and you want to get some idea from me, and you're welcome to. I'm happy to share anything that I could. Please just leave down your comment and let me know what do you want me to talk about, and I can show you how to needle it. And therefore, say hello to me and let me know where you come from. If you're an acupuncturist, please reply one. If you're not an acupuncturist, you are the practitioner, just reply two. If you're not an practitioner at all, reply two, right? Three for me. Thank you. So one is acupuncturist, two is other health practitioner, three is you're not an medical health practitioner. You're not one of the health practitioner, and you just want to come here and learn something for yourself, probably to try to do acupuncture for yourself. Anyway, let's start. Hi Miles, how are you? You're from Philippines. Yeah, I know you've been commenting on my video a lot. Thank you though. Hi Judith on Instagram. Nice to meet you. Where you from, Judith? Acupuncture as well. Acupuncturist. Right. Now, eyes, right? We do the first thing that we do, I'm going to show you, is needling the so the true scalp and tan scalp, and it's over here on the 2 meridian on this part. This is hairline, right? The hairline is neck meridian from Holland. That's great. Judy from Holland. And what about the others? One, this is King from Yama. Am I saying Yama or Myanmar? Not pronouncing very well. I'm sorry. I personally from Malaysia, right? So you're gonna needle over here, like this, right? And of course, we use short and thin needle. This is a bit bigger, right? Normally I use 0.5, no, 0.16 times 15 mm, all right? So we can needle like this. That's it. Doesn't need to be going deep, you know. Then another one, we can go over here on the side. Another one on the side over here. So we do 3 needle over here, and you can do some stimulation, gentle one, in and out, and very, very gentle, just a little bit moving, a little bit, and that is true scalp acupuncture, right? And that can, then while you're moving this, you can get patient to do exercise on the eyes. Close the eyes and look up, sideways, bottom, sideways, up, like doing a circle like this, and do another circle anti-clockwise and clockwise while you stimulate the needle. That's one of the method. Or when you do stimulate needles, you can massage the patient's eye around the eye, all the acupressure point here. And that's another one that's called Dao Yin, right? And something that I love to do is when I put scalp needle over here, in the next step, I do another needle, body needles, and put it on the hand or the knee, and that is called Dao Yin as well, using needle for Dao Yin, according to Dr. Jules, right? So this is how we do it. And I've tried that if you're just doing the needle on here and here and your knee, doing a global balance, 12 needle, and it worked very, very well too, okay? But today I'm going to show you just do global balance, right? This is the global balance, right? So we know knee, elbow can treat the eyes, right? We know there are a lot of meridian around the eyes, but if you just treat 3 in meridian, it can cover all the eyes. So don't worry about which meridian. When it comes to dry eyes, gritty eyes, eye pain, most of the time, you can't pinpoint where exactly what meridian is it. Just treat all the meridian. Very simple. Treat all the meridian. So something important here is most people will just treat the elbow in here, but normally what I do is suggest using 3 finger below elbow and 3 finger above elbow. So from here to here, you want to check any point over here, and that will treat the eyes even better, right? So let's see, get an answer point. In my case, on the lung meridian, I don't feel on the first point, second point, third point. About second point and third point, between that, I got one sensitive point over here. So I put 1 needle over here. Then I keep going. A little bit in here. That's it, right? And then I can check up here. There's 1 point over here, but sensitive. And this is local balance. So local balance, you can put more needles though. With local balance, normally you cover the image is better, the whole eye image. If we are doing global balance, you only need to do 3 needle in here, 3 needle on the opposite side, 3 needle on the knee, 3 needle on the other side knee, and 12 needle and cover all the eyes, right? So I love to do global balance, but today I just show you it still works with local balance. It works very well. You can try it. So we're gonna do pericardium meridian. There is nothing on the pericardial meridian, no sensitive point. Then we do heart meridian. Not much at all, a little bit in here, heart meridian. Just get the access point and insert needle there. A little bit in here. That's it. So I first needle superficial, put a superficial before I put deeper. All right. So now it's time for me to insert properly. So I go ahead. The reason I didn't want to insert deeper is because I was going to pinpoint, do palpitation. Palpitate, not palpitation. I'm going to palpitate all the point, right? Find out the access point. If I insert this one and I go and press that one, the needle here might hurt, all right? The needle here might hurt. If I put those two in and I go ahead and pinpoint the point over here, and those may hurt, you know? So I normally just insert a superficial first, then I needle it properly. Oh, that one's strong. It doesn't need to be strong, as long as you get the needle in, that's it. Doesn't need to cause pain at all. Just like that, simple, right? So while you needle here, and the patient can do the exercise on the eyes, I just show you they can do round and round on the anti-clockwise and clockwise. And while they do this, you can stimulate the needle over here, gentle one, you know, or you can just do one needle technique. One needle technique is you go in the middle, and then you go sideways, cover the image all in here, and then you can just use one. Now I use 3 needles, but if we do 3 needles, and you can do all the needle, you can go middle, sideways, sideways, and then middle. So the reason you want to go sideways and middle on side and sideways as well is because you want to cover all the image over here. And I find that when you cover all the image, it'll work even better. All right, it always works better. All right, especially for pain. If this patient, if I come from eye pain, you cover the image, and you don't have to do a lot of this small stimulation. That is my experience. Okay, but if you cover the image and the patient still have the pain in there, no change, or the pain decrease, but it's not much decrease, or you want to get even further, then Dr. choose proper stimulation, like just do a little bit stimulation over here. You know, there is reduce technique. You can do the reduce technique, and while the reduce technique, and ask them to move the eyes. And the others that I found is when you do the technique, you use one hand to do the technique over here, the other hand give them a little bit massage on the point around it, and they work even better. It always works better, you know. If you just do the acupressure point of around the eyes, it will work too. But when you do here plus doing here, so when you do here and needle over here, and then you do the massage over here, that is called Daoying, massage Daoying, or Daoying over here. So I love to do this plus this one. If the patient got better, I don't spend time to get massage on the acupressure point for them, you know. But I tried it. When you do this and you do this, it works very well. Sometimes you do this, bang, all gone, you know. And you just ask them to close eyes and do exercise nighttime, and have a rest for 5 minutes and do it again and again, something like that. And when they go home, ask them to massage over here, on where you put where I put needle, just one side, and that'll work. You know, it'll work, right? Julie say, nice presentation. Thanks, thank you. Give inspiration for me. That's great. Love to hear that. Thank you very much. That's very nice of you. Hi, Prasad and Jadeep Singh. Nice to meet you on YouTube. Thank you very much. This is how you can, this is one of the strategy that you can treat eye problem that I use in my clinic, and it works very well. This is just one of the strategy that I use, but I have other strategies as well. And this strategy is easy to follow and learn. And you know, you see how I needle myself, and you can just copy and do it on your patient. It's so simple. It's all about image. It's all about image. Okay, I'm gonna move the needles now. So I'm sure you can do this, right? Just go ahead and learn it and use it on your patient. If you have any question and you like me to talk other topic as well, whatever you want. If I know it, if I have an idea for you, if I've been treated, and if I allow to share with you, and that's not my other master knowledge, and because some of my master, they still teaching, and I'm not allowed to, like someone asked me about GE, and GE acupuncture, I can share some of it. I can't share all of it because I haven't got the permission from my master to share yet. I do respect my master. Okay, now tomorrow night we have a webinar. It's about acupuncture and Chinese medicine to treat coughing. So I won't do any live video tomorrow night, but I'll do it instead. I'll do it in during the day. All right, during the day. So if you want to join our English webinar for acupuncture and Chinese medicine to treat coughing, this patient is actually just came back from China and had a fever and dry coughing and diarrhea. And what do you think of? It's similar to what what's happening right now, right? COVID-19, and she was so worried about it, but she got a test and it was negative of COVID-19. So it was very, very lucky, but they gave her an antibiotic and it didn't work. And then she came, she had a lot of antibiotics actually, and she came here. Her daughter brought her here, and we started no acupuncture, just Chinese herbs, you know, and how does Chinese herbs can treat this patient, and what is the diagnosis, and how do I do with that, and if I want to do acupuncture, what point should I choose? All this thing I'm going to talk about in the webinar, live webinar tomorrow. So if you want to sign up on Facebook, down on the top, there's a link about it. Click it and submit that. On YouTube, it's down there. I haven't got the link on the Instagram, but if you wanted to, please leave a message in there. I'll send it to you. All right. And if you haven't got time to watch it on live, you still do it, because we will collect your email and it will send you. We will record this live video and we'll send it to you, the link. All right. Stay awesome, and I love you all. See you. Bye bye.